diabetes is predominantly insulin resistance. Okay, so insulin resistance meaning insulin is produced, but insulin is not acting. Okay, this is called as resistance. The resistance to action of the job of insulin is to put glucose inside the cells. So intracellularly glucose has to move where it is required. So here glucose is excess, but it is not going inside the cell. It is in the blood. So this is where you have to address that. So physical activity will improve your insulin sensitivity. So that's why exercise is also very, very important role to play.
Licensing. Thereafter, as the sales build up, there is also a certain other milestone built up in the agreement. And at the same time, they will also be getting royalties also on the product. So that is the reward they will get for their research work as per the part of the agreement.
सर आजकल सर न्यू बेबी बोर्न होता है, उसको भी डायबिटीज होता है, तो वो क्या रीजन है सर? और 100% में 99% लोगों को डायबिटीज आज की तारीख में बताया जा रहा है, तो सर इसका क्या रीजन है? और 100% डायबिटीज ही हो ही रहा है सबको?
नहीं, 100% तो नहीं है, मैंने वैसे बताया 27% of the Indian population has either pre-diabetes or diabetes, which is very high. Actually, what you are alluding to, the newborns and all that, that is actually basically genetically driven. So those are genetically driven diabetes, which you can do the chromosomal studies and find out which type of diabetes it is and how it is working. So that's one part. So major part is type 2 diabetes, almost close to 90-95%, and other 5 to 10% part in India. Fortunately, type 1 diabetes is not so high, but the incidence is increasing, where it is taking place juvenile. Earlier it used to be referred to as juvenile diabetes, where the beta cells of the pancreas are destroyed because of the autoimmunity. So this is autoimmune disease where immunity is supposed to fight the outside infections and other things, but when immunity is directed towards its own cells, you get disease like rheumatoid arthritis, you get disease like type 1 diabetes or juvenile diabetes, where pancreatic beta cells are destroyed. So this is the type 1 diabetes. But the most worrying part is the type 2 diabetes, which is exploding in our country, and the genesis of that is actually also came out in the same ICMR INDIAP study, which came in which was published in the Lancet journal, where the most important part is that visceral adiposity, visceral or abdominal adiposity, and it was first it came in 1980s when I was working in Nair Hospital. At that time, this came in the journal that Indians who are there in UK and US or European countries and the US, as compared to Caucasians, their doctors found that Indians are more prone to diabetes. So it's a combination of genetically prone plus lifestyle. So lifestyle uncovers the diabetes. And they found that Indians were less obese than the Europeans. Indians were non-smokers more compared to the Europeans, but still Indians were getting heart disease early and diabetes also early in that NRI population. And they found that the obesity of the Indians is centered around the tummy. So it is called as central obesity. So the worrying part is that at that time when, say 25-30 years ago, a cardiologist used to see just 2-3 patients of diabetes in his OPD. Now he is saying every second, third patient is diabetic. So this has led to an emergence of a new specialty, cardiodiabetology. So this is where you have, so in ICMR INDIAP survey, where 27% of the Indians had impaired glucose metabolism or impaired glucose homeostasis, about 28% Indians are obese, and 40% Indians have abdominal obesity or central obesity, and this is linked to the generation of future development of type 2 diabetes. So this is the worrying part. Though we have 27% of glucose metabolism disturbance, but we have 40% Indians who are obese from the viscera. So Indians, the obesity is around the tummy, which is much harmful as compared to obesity which takes place in the hips. That is not, that is found to be protective rather than harmful. So here, it is, this is where we are worried. So we should prevent obesity, because this fatty tissue which is deposited in the pancreas, in the liver, it is called as ectopic fat from from the fatty tissue to going to the organs. So this is responsible for fatty liver. So all these complications which are taking place, these are taking place due to visceral adiposity, and it is giving rise to inflammation. And that is why the need to address this inflammation is there, what I was referring to.
This reference of V-Life came in. So when I started V-Life, at that time the idea was to develop a software platform to fail the drug quickly. So basically, normally the cost of drugs is very high because the molecules fail very late in the trial, and all that failure cost is getting added to the successful drug. So idea with that particular technology was to fail the drug early. So we developed that technology, but there were no takers here in India because nobody was doing research in the first place. So we said that fine, we will use the technology ourselves and prove it. So that's where we started using our own developed technology, and through that we found that this particular drug, esmolol hydrochloride, binds to a protein target called aldose reductase, which is a pivotal protein in the aldose reductase pathway. So that is, it's a self-generated insight, I would say. There was no literature or any public domain information. That's why we could get patents. So we have got patents already granted in US, Europe, Japan, China, and any country that matters. So the worry that somebody would just make it is not going to happen.
So can you say this is a software simulated kind of
I would say that it is software ideated product. Not simulated, but ideated.
Depend upon the size of the wound that what is going to consume. So if you see the cost overall, it is not very costly as compared to what are the others. But I cannot compare with like betadine and all. So that's not the right comparison. That's the, and it's very easy. We are thinking future when patient can, if a patient comes from a small place, get on the first dressing, later on can locally they can do this, because these type of patient transportation is very difficult.
Now please understand that this is a patented drug, right? This is a prescription drug, so it is not freely exportable. This kind of drug has to get regulatory approval in every country where it has to be sold, right? So at this point in time, we are in the process of developing it also for US, Europe, and other regulated markets. So once those regulatory approvals are available, then this drug will be available in those countries also. Till then, India, where we have already got the approval. Thank you. To Novalid Pharma. So V-Life was first founded by me in 2002. Then I founded Novalid Pharma in 2008. V-Life got merged into Novalid Pharma. So you are thank you very much for remembering V-Life.
It's the same company. V-Life had introduced a similar drug, some
evidence available in clinical phase 3, right? In phase 3, we have done the studies up to 12 weeks. Within 12 weeks, 60% of the ulcers got completely closed. So we would like to believe that within 12-week period, almost any patient who has to get a benefit would get. But then there is a second data that after 12 weeks, for further 12 weeks if we observed, an additional 12% patients got completely healed. So basically I would say that between 12 to 24 weeks is the period where almost anybody who has to get a benefit out of the drug would get it.
Sir, there
It
is
has
a
been
question.
converted into a topical gel for diabetic foot ulcer. A product like this has never ever come before from India. So the example of Ipca's earlier success with the inflammation drug is it's an oral drug applied in new indication as an oral drug. Here the drug was intravenous injection converted into a topical gel in a new disease area, thereby enabling the company to get global patents. So Novalid holds the global patents for this particular drug. This is probably the first of its kind in India's history of 77 years of independence.
Excuse me, sir. You mean to say this is an externally applied gel?
Yes.
And it will be available everywhere in all the drugstores or what?
This availability will not be issued. We just launched. Across the country we have 4,000 dealers. These type of products are required basically where the doctors are practicing. It's not with every retailers. So I think 2 zone already it's made a good number of doctors available. So maybe another 10 to 15 days freely available. It's not an issue.
And any side effects?
There's no side effect. When you see the number of doctors, we done a survey because this is a one specialty which is not like, it's not like a pediatric or physicians. There's some of physicians are doing this practice, some surgeons are doing this, some of vascular surgeons also. So total in the country there are 2,400 doctors who treat this diabetic foot ulcer, because we collect this data from the doctor who treat diabetes. When the patient comes with the food, where they recommend. So we will definitely in the first phase goes to all the doctors to promote this product, and later on we'll expand and we have to create the noise how to save food. So we want that to go to a common man, and I think that this press conference will definitely help, because patient as on today is not aware about that.
Paralysis of one part of the body. And then the third circulation is the peripheral circulation, which is peripheral vascular disease. So diabetic foot, there is a combination of peripheral arterial disease and also neuropathy. So these are the two things together which does things. Along with that, if the diabetes is neglected, then it becomes uncontrolled hyperglycemia. The glucose levels go down. So this when the glucose is uncontrolled, the normal pathway for glucose metabolism, which takes place from glucose to ATP and it is converted into energy, that pathway is actually oversaturated. So glucose to glucose 6-phosphatase does not take place. So it goes with the alternate pathway, and in that pathway the glucose is diverted to sorbitol and fructose, which are harmful chemicals are generated, which technically we call it advanced glycosylation end products. So they will cause all the complications of diabetes. And this particular product is actually a beta blocker, cardioselective beta blocker, but was approved in 1986 for treatment of arrhythmia. Arrhythmia is where the heart beats abnormally, faster or things like that. So this product was approved. Intravenous drug was available in all the markets, including India, where it is used to treat arrhythmia and hypertension when the patient undergoes anesthesia, intubation is done. So that's the use of this product. But now it is repurposed for diabetic foot ulcer by doing molecular docking studies by Nova Leads, where they showed that it corrects the aldose reductase pathways where the glucose metabolism is directed to at the local level as well. So where it creates blood circulation impairment and all that. So when you prevent this inhibition of aldose reductase pathway, you add in the ulcer healing. So this is very, very important. But it is important to remember that not only the application of this this particular gel form at the feet level when the ulcer takes place, it is very important to address the peripheral circulation. So there are products to that, and IPCA has one product which also works there. And diabetes was initially considered just a glucose metabolism problem. It was just considered a metabolic disease. But as the science advances, your understanding also evolves. So then from metabolic disease, then it was found out that diabetes patients are more prone to heart disease. So it's not only metabolic, it is a vascular disease. So from that it came that diabetes is not just metabolic, it's metabolic also, vascular also. Then further understanding took place. Now the understanding is that diabetes is also low-grade inflammation. So there is a low-grade inflammation taking place, and that inflammation gives rise to progression of diabetes, complications of diabetes. So this is how the understanding has improved. And so there is a need to address this inflammation as well, which also can be done. So this is a comprehensive management is required. Control of blood sugar is very, very important. And this uncontrolled diabetes is creating all the complications which we are discussing, like diabetic kidney disease, retinopathy, retina involvement, and the peripheral arterial disease, peripheral neuropathy. So all these complications, a comprehensive management of all diabetes is required, along with of course we have to take care of the ulcer, because diabetes are routinely told to inspect their feet regularly.